Okay. So you have visited how many doctors before coming to me? Okay. How frequently do you get this kind of a throat pain? So it's basically a very long time you're having this issue. Okay. So one of the major causes basically is, so this is how your throat is, how your body is. So we are having, when you're having the food, you will be having your food through your mouth, you chew, and then it goes to your food pipe and it comes to your stomach. In the stomach you have the acid, so the acid usually has to go forward. Unfortunately, what is happening when you are sleeping, especially, the stomach acid is coming all the way to your throat. It's irritating your throat. Because of the irritation of the throat, you are having the cough. Yes, it is definitely related, because the acidity will have a higher chance of you to have a acid reflux. So acid from the stomach with reverse peristalsis. Peristalsis is the movement of your intestines and stomach. So it will be forward going. Sometimes there will be reverse peristalsis, where the stomach acid contents can come all the way to your throat. And it's not limited just to your throat. It will come back up to your nose as well. It can also cause symptoms of your ear, where you can have a blocked ear sensation. And sometimes you also can be having something called as tinnitus. Tinnitus is nothing but the buzzing sound in the ear. So all these things are because of the acidity. So when the acid comes and irritates this area, this is your voice box. Okay, so this is your neck, this is your voice box, this is the enlarged image of here. So when this comes here, you will have a very swollen throat. When this swollen throat occurs, especially when you try to swallow, this is a potential space. That means it is not always open, it's always collapsed. Because of the collapsed nature, when you try to swallow any food, your voice box will go up and down. So when the voice box goes up and down, there will be a swelling here. Because of the swelling, I'll show you a video where I have done endoscopy of a person who's having this kind of symptoms. So here I'm going, this is something as an endoscopy which I do. Where I say an endoscopy, I will be using, when I say an endoscopy, I will be using this kind of a scope, where I'll be attaching a light to this side, and I'll be attaching a camera here, and so much of the scope will go into your mouth. So when it goes into the mouth, so much will be visualized. It is not dangerous, as you can feel it. It is not sharp. It won't cause any pain. It is only a way to visualize. So this is how the visualization will occur. Because of the visualization, we will be seeing how the voice box is. So this patient had a similar kind of an issue what you are having. So we are passing the scope and we're visualizing the voice box. So this is the voice box. The image is slightly bizarre, but I hope you can see everything. So here when they are vocalizing, okay, I'm going, so when we are vocalizing, the patient is vocalizing. So this is the back end of the voice box. This is the food pipe area. This is the swollen part, which is an issue, because of which you are having the swelling. Because of the swelling, whenever you try to swallow, you will be having a sensation of fluid in your the sticky sensation in your mouth. This area will be swollen up. When it moves up and down, you feel a stickiness in your mouth or the throat. This is why you feel something is stuck in the throat. And this is why you also have the acid reflux, especially when you sleep, you are having the cough. The whole thing is, yes, there's definitely a cure. Basically, the cure is lifestyle changes. What are the lifestyle changes? So you are not getting cough in the daytime. Why? That's because when you're standing, the head is up or the voice box is up and the stomach is low. The acid is going forward. But when you lie down, this will become flat. So the stomach acid comes all the way to your throat, because of which you are having the cough issues. No, you can sleep. Only lifestyle modification, which I mentioned. Lifestyle modification is something which you need to focus on. What are the lifestyle modifications? What triggers acidity? You need to eliminate those things. Spicy food, oily food, coffee, tea, alcohol, smoking. Smoking is very big trigger for this kind of acidity. Other things which include also having meals at regular intervals. If you are skipping meals, that will also increase your acidity. If you are stressed, not just because of job, because of any kind of a mental stress, you will be having acidity. And you need to ensure, as I mentioned, because you're lying flat, you are having the acid reflux. So in order to eliminate that, you need to sleep in an inclined position. So when you sleep in an inclined position, the head will be up, toes will be down. How do you sleep in an inclined position? You need not change your mattress, you need not do anything. This is a very simple thing. So between the cot and the mattress, put newspapers. So the whole mattress is inclined. You'll be sleeping inclined. So when you're sleeping inclined, the stomach is low, head is up, because of which the acid will go forward. It won't go upward. And it will prevent the acid reflux. And overall, you'll be fully fine. It is manageable. It's basically avoiding the triggers which increase your acidity, ensuring that you are de-stressed, sleeping properly, having meals properly. That's it.